Hey guys, and welcome back to my video series on my double jaw surgery with reverse genioplasty. I am here finally to update you guys with what's going on in my world as far as my jaw surgery is concerned. And I am sitting at 1 year and 8 months post-op right now. So it has been a minute. I think my last video was 5.5 months post-op. So it's been a while since I've updated you guys, so I thought I should probably share my experience of what I'm going through right now with you guys so you know where I'm at. I did make a video actually a year post-op, and I ended up not posting it because, and I'll get into more why here in a minute, but I was very negative at the time. And just in rewatching the video, I just didn't feel good about it. There was a lot of topics I didn't talk about at the time that I wanted to talk about, and I just never got a chance to refilm that. I got really busy with like work and life and stuff like that after that. So I'm finally sitting down now, 1 year and 8 months post-op, and I want to give you guys an update because there's some significant things I want to go over with as far as my recovery and my results that I think are important to talk about, and that is my numbness. So if you've watched my videos before, you know that I have significant amount of numbness in my lower jaw, and most of my negativity in my year out video was due to the numbness. And I think I was just kind of finally coming to the terms that my numbness was permanent in my lower jaw, and it is a really hard thing to come to terms with. So just to recap what my numbness level is, I have basically my whole lower jaw from my lower lip all the way out here, all the way even kind of underneath here. This whole area has some degree of numbness. On my right side, I have a little bit more feeling. They have feeling, like there's some level of feeling on both sides, but this side, it's pretty numb, but I feel more. On my right side, I almost feel almost nothing really when I'm touching, especially in this area right here. My lower lip, again, I can feel it, but it's way more numb on this side. And I have a little bit of numbness on my upper lip too, like kind of on the right side, like right here. That doesn't really bother me, to be completely honest. The reason why the numbness on my lower jaw bothers me so much is that I don't have full muscle movement in these muscles down here, and I don't know what they're called, I'm sorry. But it does affect how my speech a little bit. Luckily, it's not like I have some feeling, right? Enough to where I don't have like a droopy lip and people don't really notice it, but I can tell that there are certain words that are difficult for me to enunciate correctly. It's hard for me to sing. It's hard for me to chew, like take a big bite and chew, and keep my mouth closed. Like I have to cover my mouth sometimes when I'm chewing in public, because the muscles there they're strained too much when I have a big bite of something in my mouth to keep all the way closed. So it affects everything, you know, kissing my partner, I can't feel my whole lower lip and part of my upper lip. It's just not the same. And so while I know it's not the end of the world, and at least I do have some feeling, I don't have a droopy lip, it still is just, it's hard. And honestly, it is like kind of hard to talk about a little bit. And I think that's why, like my last video, I kind of was letting loose on it. I kind of didn't know how much it was bothering me until I made the video, and I just kind of unleashed. And I did have an appointment with my facial surgeon a few weeks ago, and I told him about it, and he was like, yes, it does look like your numbness and your nerve damage is probably permanent and it won't be coming back. And I said, well, okay, it's severe enough and it impacts my life enough that I want to see about getting it fixed, see if we can repair the nerve. So he went over with me. He did a scan, like an x-ray of my skull, and he looked at the area, and he thinks that it is due to, so both sides, the nerves were stretched because my jaw was moved forward, right? So part of it on both sides is that the nerve was stretched, forward and stretched out skinnier. Therefore, the, transmission of nerves between, that nerve is just more difficult, more strained. But on my right side, and why my right side is significantly more numb, he believes is due to the fact that the nerve on this side is sitting on my hardware that he put in to connect my jaw together when he slid my jaw forward. So, in my head, I was like, oh, we'll just take out the hardware, right? Like, okay. Because he had told me before that if I wanted to, I could take out the hardware, because once my bone had fused together, I could take out the hardware if it was bothering me. But I guess that's just for my upper jaw. Like, I can just do that on my upper jaw, because he said the lower jaw, no, we need to keep the hardware in your lower jaw. Oh, always. So he said, we'll need to move the hardware. I'm like, okay, let's do that. He's like, well, no, actually, we probably need to repair the nerve itself as well. And I was like, okay, what does that involve? So he said he's going to refer me to a specialist he can't do that nerve repair surgery. He's going to have to refer me to someone to that. But as far as he knows, they're going to have to probably graft a new nerve for me and put it in there. And there is a possibility that it won't take, and I will lose completely all feeling in that side of the face. So, of course, I'm going to have to talk to the specialist he referred me to get a better idea of what the odds are of that. But just the idea that I could completely lose all feeling, not to mention just how bad it is right now, but all feeling to where I have a droopy lip and I look weird for the rest of my life, is terrifying to consider that alternative in the procedure. Like, I'll have to see, I guess, what the chances are of that happening. It would have to be like very, very low for me to consider doing that surgery, because the thought of that happening, while I would love to get even half of the feeling that I have lost back, I would be, I don't even know, like beyond depressed and heartbroken to lose all feeling in my lips, in my mouth. So, and I just don't even know, like functionality wise, how I would live chewing and stuff like that, and with my mouth gaping open like that. So that I'm going to have to get more information on. I don't know a lot about what's going to happen. I haven't talked to the specialist yet. I have an appointment with him in a month to go over things. He's up in Chicago, and I live like 4 hours south of there. So we're going to see what he has to say, and I may make more videos in the future to let you guys in on that if I decide to do that surgery, and also just to kind of fill you in on what he says as far as repairing the nerve, and even if I don't decide to do the surgery. But my doctor here that did the surgery said there was only like 5 people in the whole country he would even refer me to fix this nerve, because there's not a lot of people who specialize in this facial nerve. And I guess the doctor that he referred me to is another facial surgeon. He just happens to sort of specialize more in nerve damage surrounding jaw surgery in that situation. So we'll see what he has to say. I'm just, like I said, I definitely went through a process of like almost like mourning the feeling in my face. So I've felt grief, I've felt anger, I felt all of it. So, I mean, I'm prepared to accept that this is what I have for the rest of my life. If there's just not good odds of having a good outcome in that surgery, or I don't like the the percentage of having no feeling due to that surgery, but we'll see. That provider is in my network, in my insurance network though, so if I have good odds, it might be something that I follow through with, definitely, since my insurance will probably cover it, since they're in network. So we'll see what that has to, or what goes on with that. I'm very, very anxious about it. It's a hard decision to make when you know the stakes are so high, but I wasn't I didn't post that video because I didn't want to seem too negative about my experience, but the reality is that this is a very real possible outcome for you guys, and you should be aware of it and be aware of what might happen. It sucks. I can't sugarcoat it. It does not feel good, and I do understand that there are worse things in life, and my life will be fine if I don't get it fixed. But if it didn't happen, it would be great. Honestly, if the numbness didn't happen, or at least to this level, I would have zero regrets about this surgery. And that kind of brings me to the overall question, right? Do I regret my surgery? And it might be surprising to hear this after I've ranted about this for now, but I honestly don't regret it. And that's mostly because my quality of life, as far as breathing, having lower anxiety, being able to work out harder at the gym, I like the profile of my face so much better now. I feel like it looks better, it fits the rest of my face. I just feel like all those things kind of outweigh it a bit. I don't know, it's kind of like a baby, just barely kind of thing, but that's why the decisions to each their own. This may be something you may not want to risk in your life, and to you that reward isn't worth it. So I think it's really important to know what the possible outcomes of the surgery are, so you can really weigh what your risks are. Because I watched so many videos before my surgery of people who had this surgery, and I rarely saw anyone who, the worst I saw about nerve damage is oh, a little here, a little there. And I thought if I got nerve damage, that would be what it is. But let me tell you, I did not have an understanding of how extensive the nerve damage could be until I got this whole monster of I'm telling you, how it feels all day, every day is like someone's holding my jaw like this and pulling down, not gently, I guess, but it's like it's like someone's grabbing my jaw and just pulling. It's that constant feeling of tension in my lower lip and my muscles that are down here. So it's uncomfortable and unpleasant. So anyways, I'm gonna move away from that topic and move on to the positive aspect. And that is, if you haven't noticed yet, my braces are off. So my braces, I think in my last video was 5.5 months. I thought I was gonna get them off 6 months later, so a year out from my surgery. I did not. I did not get my braces off until April of this year, April was 2-3 months ago. So I didn't get my braces off until a year and a half after my surgery. And I don't know if that's just because after they splayed out my jaw and made it wider, I had a really big gap in my teeth up here that they had to close and then therefore move all these other teeth too. So I don't know if that just took a long time to do. I know there was little tweaks that we made. It was this tooth here was just a little in, or this tooth here was that. And so we were just tweaking little things for 6 months. It takes a long time because you can only make so many changes at once, and it takes 2 months to let that set in, and then you can make a few more. So yeah, I ended up having my braces on for a year and a half after my surgery. And I think altogether, I got my braces on about a year before my surgery. So altogether, I had my braces on for 2.5 years. So needless to say, I was very, very relieved to get my braces off. It was a great feeling. I'm so happy they're off. And this is kind of the final result. And that was another reason why I kind of wanted to wait to post a video, and I wanted to wait until I got my braces off. That way you guys could see the final result of the surgery. Here it is. My profile, my new profile. So I am happy about that. And I am ultimately happy about how it looks and how I breathe and everything like that, like I mentioned. So it's just a matter of now seeing what's going to happen with this nerve situation and the nerve surgery. I would love to resolve it. I would love to have, I probably will never have full feeling, and I understand that, but I would just love to be able to use my muscles more and have even 25%, any amount more than what I have right now, feeling wise in my face would be amazing. So we'll look forward to that. I'll fill you guys in on how that goes. I don't know, I think that's all I have for you guys today. Thank you so much for watching my video. And if you've watched my videos before, thank you for following and watching my journey. If you have any questions for me, just leave them down in the comments. And everyone take care. Thank you.